First of all, I just need to clean the face. Just use any basic eye and makeup remover. Just working over the areas that are going to be microneedled, which is your forehead, down the bridge of the nose, and on the tear trough area, cheeks, upper lip, and the chin. Secondly, we do our double cleanse with our Clinicare cleansing foam. We just need a small pea-size amount of the product. This is then lathered up using warm water to create a nice soapy cleanser. Work this into the areas, which is our forehead, down to the temples, into the cheeks, above the top lip, and the chin area. Just circular motions just to cleanse the skin, make sure it's nice and fresh and bacteria free before we do any treatment. This is then just removed using damp cotton pads. Once the first cleanse is done, we repeat the process. Double cleanse, pea-size amount of product, lather it up using water, and work it into the same area. The forehead, temples, the cheek, top of the lip, down the nose of the bridge, and the chin. Again, remove this using damp cotton pads, just with the tepid water. Making sure all the foam is completely removed. From the face. We then change our gloves. We then use a Vistasept antiseptic spray. We protect the eyes, spray the forehead, the cheeks, and the chin. We are now ready to microneedle. We have our serum, which we've already drawn up using a syringe and a red blunt needle. We have our Dr. Derma pen. We're going to set the black triangle to 0.25. This we will separate the head, the forehead, and do the 3 passes. First of all, just need to lubricate the area using the serum. Press and hold the button. Do our first pass, which is from the centre all the way to the end of the forehead. You don't need to apply any pressure. The cylinder needs to be moving at all times and mustn't be kept in one place for any continuous length of time. The first pass is complete. We then move on to the second pass, which is up and down, making sure the cylinder is moving continuously. And finally the third pass, which is circular motions, working from midline to lateral forehead. The skin will start to go red and it may even break in some areas. This is perfectly normal. Then move on to the second part of the forehead. Lubricate the area with our collagen serum. Work from centre all the way out again, making sure the needle and the cylinder is kept in contact with the skin at all times. That's the first pass. The second is up and down. And finally circular motions inwards all the way to the end. Because the dermapen is already set on 0.25, I'll go down the bridge of the nose and I will also just lubricate under this tear trough area. Because the tear trough area is very delicate, we only need to do one pass. So from the bridge of the nose, on the side, and then finally just one pass underneath the tear trough area, because we don't want to create any swelling. We can press and hold, turn the button off. We're moving on to the cheeks. We can then turn the dial so the triangle sits under 0.5, and we can then target the cheek area, which start underneath the tear trough and end at the lips. Lubricate the area again, this section here. Press and hold the button, making sure the needles don't protrude out the top of the cylinder. First pass all the way down. Second pass, which is ups and downs. And finally the circular motions, working from the centre all the way to the end. Move on to the second section, the cheek. Make sure the area is lubricated. Again, working just underneath the tear trough, all the way down. Ups and downs, which is the second pass. And finally circular motions. Press and hold the button to turn the dermapen off. We're now going to do the upper lip and the chin. So we take the dial back down to 0.25. 0.25, because it's a very small area. This will help with fine lines and smoker's lines. And we can relax. Finally, the chin area. All the way across. First pass. Ups and downs, which is the second pass. And finally, swirly circular motions. That's the microneedling complete. Press and hold the button. Twist and lift the cartridge head. This is a sharp, so it needs to be disposed of in a sharp spin. And we just apply a nice smoothing mask, as the client's skin may be a little bit red and a little bit hot. Place the mask over your client's face. Leave them there for approximately 5 to 10 minutes while you go through the aftercare. Which is, you need to wear SPF 30 tomorrow.
I've got 50, so
that's great. Nothing hot for 2 weeks, sunbed, sauna, steam rooms. It may be a little bit red, a little bit tender. If you do get any loose peels or flaking, don't pick anything off. Avoid any fragrance products for 3 to 5 days, and try and use an intense moisturiser on an evening.